So I'm going to be demonstrating lymphatic massage on Nicole. I'm Athena Jezik, craniosacral lymphatic drainage and massage therapist. We begin by opening up the nodes that are right underneath the clavicle. We open that up because that opens up the rest of the system. The lymphatic system does not have a pump, and so if the system gets overloaded, the nodes tend to get full and they cannot take the flow of the fluids through very well. So a manual drainage is important to get the stimulation going with the lymph vessels so that the system can get back up to its integrity. So we begin with the nodes right underneath the clavicle, and we work along what's called the neck chain. We go along the neck chain, going around the base of the neck and coming up the neck, then down the neck to rinse it, and up the back side of the neck and back down the neck. We do the face next. So we drain the chin, the face, the nose, the cheeks, and we just move through it in the direction that the system flows to the various nodes that it gets dumped into. How it works is we move the fluids of the body into the lymphatic system to be able to drain the fluids out of the tissues and get them back into the lymphatic system so it can process toxins out of the body. Then we do a little bit with opening up the upper portion of the lungs. The benefits of lymphatic work is it keeps our bodies from retaining water. It's a good thing to do if we have any kind of water retention. Oftentimes water retention occurs from having too much toxicity in the body or from not being hydrated. So we can move that out so that the toxins aren't going to settle into the cells and tissues and be walled off and create other problems. Tumors or cysts or things like that can also be a problem if the lymph isn't flowing very well. We open up the axillary areas, which is underneath the armpit. The fluids will dump into the heart. From the heart it will be carried into the liver. The liver will process what it needs to for proteins, and it will cast away any toxin that's there, and then it's carried out into the kidneys and bladder and excreted from the body. From there we move over to the arm and drain the arm, working proximally to distal. So we're opening up the fluids closest into the body where the nodes are and moving out. It's kind of like when you're trying to drain something that has a lot of water, like a ditch. You have to open up the area that you want it to go, and you keep moving back. So instead of starting distally, where you would be pushing the fluid but it wouldn't have any place to go. So we open it up proximally and then work distally, which is what we do on all of the limbs. But here we're doing it on the arm. So if you're wondering if lymphatic work would be good for you, if you are on medications and you're trying to get farther away from them, or just on medications and you feel sluggish from them, it's a good thing to do. If you have congestion in the neck or face, or your stuffy head or itchy eyes, it's good for that to have the face drained. If there's digestive problems, that was a good thing to come in. If your ankles are swollen, if your legs are swollen, if you feel full of fluid, particularly if you're to a point of pitting where the fluids are staying so much that you poke your finger in and there's a dent, that's very important for you to have lymph work if that's the case on any of your extremities. So here we're working on the abdomen, and I start by opening the nodes alongside of the rib cage, and then work down and then begin to open up the abdomen by pumping the left upper quadrant toward the axillary of the left-hand side and working in that quadrant, moving it in that direction. Lymphatic work should be done about 3 or 4 times a year for the preventative measures, and you can keep yourself in very good health. Then we move over to the center into the cisterna chili, which is a little like cistern that collects a lot of the lymph from the deeper structures. We drain that. Children who have colds, earaches, that sort of thing will remedy it quite quickly. children usually love it. They lay down quite well and they feel very comfortable with it. So that's a good indicator that it's good work when a child likes it. Then we just shake the abdomen a little bit to loosen up anything and to just see if there is tightness in the tissues through the abdomen at all. Because if it's not flowing well, there'll be a tautness. And if it moves back and forth kind of jello-like, then we know that we're loose and the fluids are moving well. So then we go through and we drain again, moving that a little bit from the quadrants out to the axillary and inguinal areas. Draining the liver is the last thing that I'm doing here today, is draining the liver so that the liver can have a good free flow of fluids. And then we rinse it all out and drain it back up into the axillary and up into the nodes, the clavicular node. Here we're working on the leg. So we start with the leg. We start up at the inguinal area, which is inside of the thigh. There's a triangle that has a lot of structures in there that are delicate. It has the nerves all go along that track. The lymph vessels go there. The lymph nodes, there's quite a few of them there. And also the veins and arteries are in that section. So it's a very delicate area. So we begin by working here and pumping that upward into the lower quadrants of the abdomen. And then after we get that drained and opened, we open it up down to the knee and come up and then pull the fluid flow from around the leg and direct it towards the inguinal nodes. This work is used post-operatively when people have had operations, surgery, that sort of thing. The anesthesia is oftentimes left in the cells, in the tissues of the body. So to have the lymphatic system manually drained will assist in removing those drugs out of the body. Working down, getting into the popliteal nodes, the nodes behind the kneecap. Working down the shin. If someone is detoxifying because they feel like they need to detoxify themselves, this helps the body to be able to go through that process as well. Ankle, foot. Reasons to do lymphatic work would be for fluid retention of the body, post-operative work to get the anesthesia out of the system, any kind of tension in the gut if the gut isn't moving well to help get the digestion moving, colds, flus, swelling in the neck, swelling behind the ears, coughs, any kind of lung congestion, any kind of digestive problems. All of that is important for lymphatic work and can remedy it quite well. So all in all, it's something that should be done on a regular basis, a few times a year, and you can experience optimal health. And that is pretty much of a lymphatic drainage session.
If you liked this video, we have hundreds of more alternative videos ranging from sexual health to psychology to mind control. So if you liked it, go ahead and click on me to enter the Psyche Truth channel.